Hello, good afternoon. My name is Dr. Adrian. Welcome to Facebook Live, kindly organized by Oriental Laka Street Medical Center. And today I'm talking about heart and lung problems and with the update in minimal invasive heart and lung surgery. Okay, and I hope you enjoy it, and please post some questions. I will try to answer them all at the end of the talk. Okay, so anyway, this is my profile. I'm trained in the United Kingdom, and then I spent 20 years there. After that, I was invited to work in Singapore for 6 years, and after that, I've been honored to come back and work in Malaysia. Now, I'm the heart and lung surgeon in Oriental Hospital, and also volunteer my service to Sedang in Putrajaya. Okay, and I'm also invited to internationally to give talk and as a pioneer in cardiothoracic surgery. Welcome to Oriental Hospital. We provide comprehensive cardiac services. As you can see, we have two very good and excellent cardiologists, Dr. Maujad and Dr. Lee Boon Leong. And also, when the heart disease becomes very severe, I'll be referred to look after them to perform minimal invasive heart and lung surgery. Apart from heart services, we also have lung services. We have an excellent Dr. Rashida, who is a very good lung specialist, and she often refers me many challenging lung cases, but I can manage to perform minimal invasive surgery for them too. So what am I going to talk about today? I hope I don't bore you too much. However, they are quite relevant. Why? Because according to World Health Organizations, 6 out of 10 top 10 killer diseases are from heart and lung alone. Okay, and every 5 years they renew the data, and it hasn't changed. Heart and lung and stroke are the top 10 killer diseases in this world. Okay, and why is it important? Because there's the largest increase in mortality or death actually happened in Southeast Asia. Okay, population will die prematurely, and it has adverse economic impact on our country. Okay, so the topics I'm going to talk about, let's start with the heart. Now, if you experience any chest pain or any discomfort on the chest, please go to your nearest hospital, regardless what age you are. Okay, because if you look at this, diagram, if there are clots on the artery, the blood flow which carries oxygen to our heart is limited. So when it's limited, you actually experience chest pain called angina. However, if your plug structure, suddenly the whole artery can be blocked out. There will be no blood flow to the heart at all. Then the heart muscle will die, and we call that a heart attack, and it is very dangerous. Okay, and you must go to the hospital, because what our specialists will do is to give you medications. Majority of the time you'll be alright. However, sometimes you may have to do the immediate angiogram, to do balloon and stenting to open up the artery, and sometimes you may have to undergo heart surgery. So let me show you actually what is balloon and stenting. Okay, so our cardiologists will take you to the cath lab, and they may put a catheter to suck out the blood clot. Once they clear the blood clot, they will use a balloon to open up the clot and the stenting to keep it open. As you can see here. Okay, so that is a life-saving procedure. They can do it within 1 hour of your chest pain and save a lot of life. So if you have any chest pain, please visit your nearest hospital. Now, when do you need a surgery? Sometimes, we have 3 blood vessels in our heart. If the 3 vessels are blocked, partially blocked or severely occluded, it is time for you, unfortunately, to do a heart surgery. Okay? Or despite medication or stenting and you still have chest pain, then you may do heart surgery. Alright? And don't worry, because heart surgery now can be done very safely. Very, very safely. And it will last 10, 15, 20 years without any problem. Okay? And also, there are trials around the world which shows that in triple vessel disease, bypass is much better. You have less incidence of stroke, death, and heart attack if you have bypass in triple vessel disease. Okay? Now, what do I do? In a simple diagram for bypass case, I open up the chest and I take the artery and connect to the heart artery beyond the narrowing, so to re-establish the blood flow. Alright? There are many ways of doing the bypass surgery. And there are bypass, there are beating heart surgery, minimal surgery, robotic surgery. However, the mainstay at the moment is still bypass, is still beating heart, and OPCAP as well. Okay, let me show you this. This is open chest surgery with beating heart. This is the actual heart you are looking at. Okay, and we connect the vessel to the heart artery beyond the narrowing to establish the blood flow. Okay, so that is what bypass is. A very simple operation. There are evidence that it works for beating heart. Okay, and also we can do a small window bypass surgery. However, this is only for a single artery. And for robotic, yes, it can be done. However, it's not popular because it's very expensive and there's no trial to say that it's actually good for bypass. So there are evidence that it works, but it's really just too expensive and takes too long. The robot may not just be advanced for bypass surgery just yet. However, for valve replacement and valve repair, yes, robotic has been established itself as a minimal invasive surgery for the heart. Okay. Apart from robotic, what else is there for the minimal invasive heart surgery? Yes, it's called TAVI. Okay, transcatheter aortic valve replacement. Either go through a small hole on the chest or go through the groin. Okay, and this is very, very advanced, very safe technology. However, like all things else, the new technology are quite expensive. Okay, if you can afford it, it's good. And hopefully in future the prices will come down and more people will benefit from this very good procedure. Now, any more advances as heart surgery, especially if robotic cannot be used for bypass. So is there a truly minimum invasive bypass surgery times 3? Yes, there is. Okay, this is called MICS, minimal invasive CABG surgery. As you can see, you open up a small hole on the chest and you can bypass 3 vessels through this small opening as well. Okay, it is not just on the diagram, it has been done in real person. Alright, and this is the first patient in Singapore with Professor Covidis at NUHS. We successfully performed the surgery through a small keyhole, bypass times 3. Alright, compared to traditional, yes, it's big. However, this is still a very simple surgery. We try to make it look nicer for you. However, the biggest problem actually for bypass surgery is harvesting the vein from the leg. You can see the traditional is a big cut from the leg just to harvest the vessel. Later we try to do it intermittent cut. However, now with the new machine, the cut is a small hole. You can harvest the whole vein through small opening on the leg. It's called endoscopic vessel harvesting. Okay, it's the latest machine. It's very, very good. We use it up on our patients, and you can see instead of a big cut, we harvest the vein through small opening. The benefit is that the patient can actually stand up and walk on the next day. And most of my patients at Oriental, they go home on day 4 or day 5 after bypass surgery, thanks to the equipment. Now, we talk about the lung. Now, okay, we finished the heart, we talk about the lung. Well, apologize for this picture. This is a picture of your normal lung. However, if you smoke, your lung will become like this. This is a heavy smoking lung. Okay, terrible, right? Okay, it's called emphysema due to smoking. So, if you continue to smoke, the top of your lung will be destroyed by the cigarette and you cannot breathe. So, sometimes surgeons has to go in and cut away the top of the bad lung so your normal lung can expand and breathe properly. However, we have keyhole procedure, so you don't have to have a big cut, a small hole. We can do that for the smoker, but the mainstay of the treatment is still stop smoking. Now, I don't have to explain about this, okay? It is understood for 50 to 60 years. If you smoke, you're going to have a lung cancer. If you continue to smoke or smoke a lot, your cancer will spread, okay, like this. Well, is lung cancer a death sentence? The answer is no. Whatever stage you are on, stage 4 is already spread, you need chemoradiotherapy. But for stage 1, 2, 3, remember you have to speak to a lung surgeon before you decide what to do, because surgery is the only chance for a cure. The only chance for a cure for lung cancer for stage 1, 2, 3 is surgery. Okay, so please speak to your surgeon. Thank you. Now, so what do I do, or what my colleagues do for lung cancer surgery? You have traditional opening, thoracotomy, a big cut to take out the cancer lung, or video assisted lung resection with a multiple keyhole, or robotic. But robotic is not the most advanced. The most advanced is a single keyhole uniport VETS lung surgery. Let me show you robotic. Okay, this is robotic lung surgery, lobectomy for lung cancer. Performed my first robotic lobectomy actually when I was in Singapore in May 2012. One of the earliest robotic lung surgeon to perform the case in Singapore. And there are evidence that robotic lung surgery is good for you. Okay? Okay, apologize again for these gruesome photos. This is performed in World War I. Because of gunshot wound, severe infection, they cut a big cut on the lung just to clear the pus. This is called extensive thoracotomy. It's quite a bad surgery because the patient actually suffered quite a lot just to save their life. Now look at this, the thoracotomy. Unfortunately, many lung surgery are still being performed like this, a big cut on the chest. Okay, but things have progressed fortunately, and now we have the most advanced lung surgery called uniport VETS lung surgery. And you can see instead of big cut, everything is going through this one small hole. May it be infection, lung cancer, TB lung, draining and effusion, biopsy, everything can be done through here. You have a scope, you can see clearly what's inside, and you can squeeze 3 other instruments to do the operation. Okay, and it's very safe. Patient can go home day 2, day 3 after lung surgery because of uniport VETS lung surgery. Are they good? Yes. Many patients are happy. I'm not sure how clear you can see. The scar is very small, one scar. On all the patients that are done for lung cancer, okay? Pioneer in the uniport lobectomy. My first case in Singapore in June 2013. My first case in Malaysia, 2016. One of the first few pioneers who do it in Malaysia and Singapore. And I do share my expertise across the country and across Asia as well. Yes, of course, with that I have many happy patients too. Okay? Now, if you don't look after your health, you smoke, and you have chest infections, and you do not go and see the doctor, you will get worse. You will develop pus inside the chest, called empyema. If you have TB, you don't take your medication every day, the TB will progress. You will also have pus inside your chest, or pneumonia. Okay? So what happens when you have pus inside the chest? Remember the gruesome picture I showed you? People cut it open and let the pus out. But do we really need to have a big cut? No. Now with the uniport, we can do uniport surgery as well for empyema. Okay? Now, would you cut open this young lady's chest? She is 14 years old and she has TB empyema. Okay, so when she came to me, she said, please don't open my chest. I said, not a problem, I do it by a single keyhole. She has stage 3 empyema, TB empyema. Very extensive disease, and I managed to do it with the uniport pads for her. Okay, and she's very happy. These are the picture of me attending international conference, organizing conference to teach the junior, the next generation of lung surgeons. Of course, I learn from them as well, not just I teaching, we're exchanging. Okay, and there are many Malaysian surgeons now are very good in this world too. Okay. Okay, what about other disease? Chest deformity, sweaty hand, armpit, mid-chest mediastinal tumor, can all they be done by single hole VATS surgery? The answer is yes. Okay, look at this. This is called pectus excavatum deformity. You have a very sunken chest. It's not a congenital disease, it's a development abnormality when a child grows up. Okay, they are not born with it. Okay, then you have a mid-chest sunken in. So how do we do it by a keyhole? Very simple. It's called NAS procedure. We insert a U-shaped bar. When we flip them over, we push the sunken chest up. Alright? It's actually quite simple and very smart procedure. You look at this chest. Okay? You have a sunken chest in between. Whether you are female or male, you are not going to be happy when you look at yourself in the mirror, and they actually affect your life and the mentality, and it can cause depression. Okay, so when we insert the YouTube bar and flip it over, you can see now the chest is nice and flat. Okay, do you think she's happy? I don't want to say who she is. However, after the procedure, she's very confident and very happy. Okay, next. Sweaty hands and armpit. There are some other people who is very unfortunate. Again, this is not a congenital. They develop later in life. The hands become very sweat, even when they don't do anything in the aircon room. Okay, same as armpit. So it's a development abnormality. They do nothing, the armpit will sweat a lot, the hand will sweat a lot, it will interfere with their life, they cannot play sport, they cannot write, their textbook will be very sweaty. So what do? We can do a simple keyhole procedure to cut the nerve that supply the sweat glands. Okay? It's called sympathectomy. It's done by a small keyhole, and the patient are very happy because when it's done, the hand is nice and dry. It doesn't affect their life anymore. Okay, they can carry on with a normal life. Okay, what about thymoma or thymic cancer, myasthenia gravis? These are cancers that grow in the middle of the chest. It's not a lung cancer, it's a mediastinal, the chest tumor. Now, if it's in the middle, most of the time, if you have it, you go and see a surgeon and say, no, you need to cut open the chest in the middle to take it out. But no, you can do it with a keyhole procedure with one hole only. Okay? Both male and female patient with a thymoma, thymic cancer, myasthenia gravis, you do it with a simple cut and take the tumor out. Okay? If you're a lady, you'll be very happy. The scar is so small and it can be very well hidden. Okay? Of course, with keyhole procedure, now arriving in Malaysia, they are very happy Malaysia patient now. Okay, whatever race you are, they are very happy to have a minimal invasive procedure. Before I finish off, Oriental has started cardiac surgery. We started the cardiothoracic team thanks to the support of the management and also our cardiologist and chest physician and all my colleagues. We have their cardiac team, cardiothoracic team. Okay, we start our first heart surgery in October last year. Okay, and of course we have successful outcome. Many of the patients in Ward 6B, our cardiac ward, with dedicated team, nurses, surgeon, anesthetists to do the procedure. Okay, everyone was very happy, and we are the best of the best in this region. Everyone take their job very seriously in cardiac surgery. Okay, right? Many successful cases, heart surgery now being performed at Oriental Hospital. Okay, you are welcome to see us, visit us if you have any surgery that need to be done. Okay, and we have our dedicated cardiothoracic anesthetists that join us and make us one of the best cardiac team in Malacca. Alright, and these are the patient who has bypass ×4, and guess what? One day after surgery, he's sitting up reading newspaper. Okay, I have to put this up. Okay, I'm so happy and the patient is so happy. And endovascular vein harvesting, you see, is very minimum cut. Okay, and in the clinic, you can barely see the scar on the leg. Of course, patient and the wife and the family are very grateful and very happy. Yes, this gentleman is almost 80 years old. We did CABG on him this year, and to everyone's surprise, he did very well. And again, one day after surgery, he's sitting up on the chair, taking picture with me and with the team. Of course, he is very happy when the family and everyone is very happy and glad that he did very well. Okay, and this is taken in the clinic for follow-up. Another patient has valve replacement. Okay, he also did very well at Oriental Hospital. This is also one day after valve replacement. He's sitting up on a chair with a leg crossing. I don't know. I think he is happy. Okay, and there are other happy patients too who have had their heart and lung surgery done at Oriental Hospital. Okay, again, this gentleman has bypassed. You barely see the scar at all. And one of the lady who has okay, I don't want to say who she has, just in case a friend see this. However, you have a small scar at the side. She is very happy, of course. Anyway, thank you very much for your time. I think I have said enough. So maybe I leave some time for you to ask me any questions, okay? And I would like to thank you, my family and my friend who support me, and the hospital who put a lot of effort into this cardiothoracic program. And again, I'd like to thank my colleague for all the support that you did through. I'm just one man, but this is a teamwork. Without everyone, all my colleagues' support, it would not be sustained, it would not be successful. So far, all of you supported me 100%. I'm very grateful about that. Okay? And thank you for those who go on the Facebook, give me the like and the encouragement. Thank you very much. Okay?